Hello, YouTube. So, are you guys suffering from headaches? I'm Maxine Lamoureux. I'm a licensed massage therapist and a Canadian trained manual osteopath. Earlier this week, I asked on our social media, where do you have headaches? And I said I would create a video to help address how you can take care of these at home. So, I've got a chart here. It's not the same chart that I used in my post, but basically what I got was a lot of people are getting their headaches here around their eye, question mark headache around the side of their head, and on the top here. And there's a couple muscles in particular that affect these. What we're looking at is your this is a tension headache that we're addressing. And so here are some tools to help alleviate this. So first of all, a lot of these are posturally induced, and the muscles that are involved with these areas are predominantly your upper traps. So your muscle that's right here, and it attaches onto your shoulder blade, your scapula, and it comes into your neck. And then also your suboccipitals, which is right at the base here where your skull meets your spine. It's a very important area. We've got 4 tiny muscles there that facilitate a lot of range of motion. And through that area, we can actually access into our dura, which envelopes our spine. And there are some nerves that can come through there. So sometimes you're even pinching your nerves a little bit. And so the common trigger point patterns is you get this question mark comes here. It can even come into your eye. You get a headband headache, and then sometimes right on the top of your head. And right on the top of your head is actually also very common following whiplash. And I mean, your whiplash may have been years ago. When you do this whiplash forward and back, we have this muscle right in here called the longus coil. And that can also, if it has a trigger point, you'll feel like your throat is irritating you, like it's bugging you, but it's not going away. So in Canada, because I'm from Canada, we might think we have a sore throat because during the winter we get a lot of sore throats, and it's not resolving. So that's an easy one. What you want to do is gently bring your thumb in here, and you can just gently massage. You just do one side at a time, and then you can hold the tissue. So sink your thumb in a little bit. Shouldn't be painful. Nothing should be more than a 3 out of 10 in discomfort. And then keeping your teeth together, extend your neck posteriorly. So put your thumb in here, gently inhale and exhale as you go into extension, releasing in this area. This is an area that a lot of people don't address, and it can have an impact even on your TMJ, which I have a couple of videos on that. Now, going into our traps. So our traps facilitate a lot of range of motion. So the basic first, what you want to do is create range of motion. So stretching out the area is going to help. And so what I recommend is making sure you're not cheating. Sometimes we bring our shoulders up. Just bringing your ear to the opposite side is going to help. And to make sure that you're not cheating, you want to hold on to your chair or hold on to your elbow with the opposite hand. So you're making sure it stays down, and bring your head sideways. And when you're doing a stretch like this, you want to hold it at least 30 seconds. And notice that I'm not deviating. I'm not quote unquote cheating by rolling my nose towards my armpit or looking up to the sky. When we have reduced range of motion, our body still wants to go into the range of motion, and so sometimes we'll compensate. So be mindful that you're staying aligned and you're combing sideways. Again, 3 out of 10, it should not be painful to do this stretch. Also, when you've got a trigger point, heat is your friend, so apply some heat. I also love using Deep Blue through doTERRA. It's got lots of medicinal purposes. Rub some Deep Blue, do your stretch. Now, for your suboccipitals in here, this is a harder area to stretch. It's very minute. And so what my go-to is actually using yoga tune-up balls. These are my favorite. These are the alpha balls, so they're the biggest set. They're blue, and we can make all the jokes in the world, but these things are great. And actually, they're really great at relieving tension in your traps as well. And so what I like to do, it's actually called a still point, which is from craniosacral therapy. I think it was John Upledger that created it. And so what you're going to do is you're going to take balls. Like I said, these are my favorite. And the reason that I really like the yoga tune-up balls is because the tissue, the material that they use is designed so that it sinks into your fascia. Your fascia is your connective tissue, and your connective tissue is what's wrapped around every single muscle fiber, all your muscle to create its individual muscle belly. It's what's wrapped around your tendons, your ligaments, your bones. It's everywhere. It's underneath your skin. And if we can release the fascia, you have a much longer lasting impact. And so you don't have to use yoga tune-up balls. If you don't have these, 2 tennis balls, put them in a sock. And you're gonna lay them right here, right at the base, okay? So you're gonna place them right here, and you're gonna lay on your back with them right here. And you can move these balls as needed. If they're toted or in a sock, then they stay in place a little better. And what you wanna do in that area is take some really big diaphragmatic breaths and feel it release. Just breathe into it and release, release, release. Once it starts to be, more enjoyable, you feel like it's letting go, then you can gently rock your head right to left and then up and down and just work into that area. So these are really great stretches and tools that you can use to mediate your headache. And it's really important that you breathe through these. You don't want to be holding your breath through any of these stretches or exercises. The other thing is, I already mentioned the deep blue is a really great oil. Peppermint is also really beneficial when you've got headaches. It helps release the muscles. An Epsom salt bath is always going to help. It gets into the muscles, especially because we're talking about a tension headache here. But also, prevention is the best form of medicine. And so doing a little bit of neck range of motion and then making sure that you've got proper posture. If you're working at a desk, you want to make sure that your shoulders are back and down and that your neck is in alignment. You want to make sure that your desk, your laptop, or your screen is at a height where you're going to be looking up and you're not looking down. Because when you're looking down, you're overstretching your suboccipitals here, but also you're looking down. We already, as we get tired, tend to slouch forward and round our shoulders forward. If you're looking down, you're going to go into that position faster. So come back up, bring those shoulders back and down, keep your chin nice and high, keep that nice, strong postural integrity, strengthen your back, do some exercises to strengthen your backs. We've got a whole bunch of videos on that. And so you can avoid it. And also I did a video, I've done a few series on neck range of motion. Incorporate those. If you suffer with headaches regularly, when you go to the gym or in the morning when you wake up, incorporate just right away doing some range of motion. And it'll really help prevent the headaches from coming on and alleviate when they do come on, they won't be as intense. I hope you found this useful. If you have any questions, please do not hesitate to reach out. I think these are really easy things that we can implement in our lives to, be able to enjoy life and not get held back by a headache. It's something that I suffer with too, so I'm happy to help you guys work your way out of it. And then of course, as a massage therapist, I'm always going to recommend book yourself a massage, have someone work out some of those kinks. Sometimes you're misaligned, so, reaching out to your osteopath or your chiropractor to realign your cervical spine, oftentimes it starts in the T-spine, will help alleviate all the postural imbalances that are causing your tension headaches. Thank you so much for following us. We appreciate you. Like, follow, subscribe if you want to keep getting all of our videos. And I'm here for you. Have a fantastic day. Cheers.